Hi everyone, Dr. Rich Castellano, the Smile Doctor. We're here at Image Lift with Stacy. Thank you for letting us share your video today. So Stacy, we're going to do some radiesse, and she says these areas here is around the mouth, mostly the focus here where we marked out in the white. She wants to address the radiesse is a great filler because it's a collagen stimulator, and in the past, you've had some filler that did well for you that was quite a while back. So today, we're going to use that one syringe. We'll use a little bit in the smile lines as well. Any questions about our goals for today? Okay, very good. So I'm going to do a little cleanse on the skin. I like to use my Avogard. We have the Purell cleanser too, but you know what's funny is when you push on those things, it can squirt across the rooms. You gotta sometimes dodge it. I mean, it can get you. So I use the Hiba Cleanse and alcohol to cleanse the skin. It's very uncommon. I'm going to sit the chair up just a little bit here, and then rest your head all the way back. Is that okay for you? Or we move the headrest a little forward for you?
No, that's fine.
Okay, so a little cleanse on the skin with the Hiba Cleanse. It's rare to get an infection, but we still do the cleansing. These are the insertion points here and here that I'll use the safety cannula. The cannula is a soft tipped needle, less traumatic, less bruising. I still remember when I first started doing fillers that we only use needles for the fillers, and I'll use needles for superficial injection and in the lips, but and I'll need a buzzer too. Can you put one into a glove for me, please? But I like to use the cannula as much as possible, and then if it's a superficial or lip injection, then I will use, that's perfect, that's fine. I will use the needle for a superficial injection. Now, I use the buzzer. You feel the buzz, and then you feel pinch on 3, 1, 2, 3, pinch. You feel small, medium, big pinch, not too bad there. And then buzz and pinch on 3, 1, 2, 3, pinch, little pinch. Small, medium, big pinch, not too bad?
It is not too bad.
Not too bad, okay. We try and make it easier than the dentist's office. 1, 2, 3, pinch. But no root canals today. And 1, 2, 3, pinch. So a little bit of numbing. And I find this approach works better than topical, because topical, the injection, the filler is going deep. The topical really is only superficial. So even if you're numbing it superficially, I'll need a cannula. Can you please put the cannula on the gray one? Thank you. You still have to go deep. Perfect. You still have to go deep with the cannula, so you might as well numb these. So
Numbing's better.
Numbing is definitely better. Now, once I have the numbing, I'm going to make a little insertion point. You feel a little bit of a pinch there, or not too bad?
Not too bad.
So that's the insertion point. It's like a tiny little pore, because the cannula is a blunt tip cannula.
I wondered how that worked.
Say again?
I wondered how that worked.
Yes. So I make a little insertion point. It's magic. I'm going to turn your head just a little bit this way. So I find that little bitty insertion point. So now I'm twisting, twist, twist, twist to advance as atraumatically as possible. I like using the Radiesse. Once patients come back for additional fillers, sometimes they say, don't you have something that lasts longer? Or we do have permanent fillers, but it's a good idea to start with the short-term fillers and get a feel for where things are. And also, Radiesse is a really good collagen stimulator. Stacy, do you feel big pinch, little pinch, not too bad?
Not too bad.
Everything's looking good. So now I'm injecting directly for that, what we call the melolabial fold of the frown line. And I can also use Botox in this area to lift that up a bit. Now that I've done about 4/10 of a cc, I'm just going to use a couple of attempts to get a little bit of a hollow here, and I'm just going to strengthen the jawline. So she'll feel a little pinch there. Shiver technique for a very, about 0.5. I'm going to do the same on the other side. And I'm going to show Stacy before we're done so she can see. So again, I find that little pore that we created here. I'm going to turn your head to the side just a little bit. Twist, twist, twist allows you to advance as atraumatically as possible, minimize bruising and minimize discomfort. I'm going to start with 4/10 of a cc in the smile line. You'll see it plumping up the corner of the mouth. Of course, the smile always looks the best, and Stacy has a great smile and she uses it often. But we'll do our part to help create a more refreshed and more youthful appearance, and if we want to look even younger than what the cosmetic treatments can do, then you just have to act immature. And then another little 0.2 of a cc right in through here, so it's about 0.6 of a cc I'll be using, and I measure very carefully, so we're using about the same amounts on each side. We always have asymmetry. One side's a little more full or a little more hollow than the other side. That's very normal. And we often don't notice asymmetries in our face until we do a cosmetic treatment. After we do a treatment, our vision gets better and our memory gets worse. So that's why we take our photos before and after. So now I still have about almost a third of the syringe left, but let me show Stacy where we are so far. So can you see how it clumps in those areas?
Oh, yeah.
How does that look so far?
Yeah.
Hold this mirror for me, please. So with what we've got left, I can keep building a little more here. Do you think you're just building more there and then we'll hold on the top? Or what do you think, a little in the top? How do you feel overall?
Well, this side looks better than this side.
Oh, and I started on this side, so you'll, even if I don't inject anything, you'll have a little swelling from
Right.
the cannula. So, as we say, you don't want to taste the chocolate cake before it's done baking, but I put equal amounts. Let me keep layering in through this area, and this way she feels, okay, it's not too much, you're in control, so I'll focus here. This way we'll just skip this area, we're just focusing on your target area, okay?
Okay.
Very good. Move this away. And Claudia and Yesenia have everything set up perfectly. You can see in her pictures before here where the downturned corner of the mouth, we're starting to lift that up, so that's the before picture. And Stacy is the after. Okay, let me have you rest your head all the way back one more time for me, please. So, you turn your head here. So we're focusing right in this area. And at this point, she'll feel even less because there's lidocaine numbing medicine inside of the filler. Makes it even more comfortable. Do you feel pinching there? Not too bad?
Not at all.
Very good. I tell patients it's okay to massage afterwards. If you feel a bump or a firm area, you can just massage and it will settle. Radiesse lasts about a year to a year and a half. It is a very good filler. If you take an x-ray, you actually will see the filler on x-ray, but it doesn't...
Really?
Yeah, it doesn't, because it's calcium based, just like calcium hydroxylapatite, which is what we find in our bone. Pressure pinch. So as you can see, fillers are simple. They should not be excessively painful. You should feel little pinches. I tell my patients if we need to take a break, you let me know. It's very rare patients say they need a little break. Sometimes if the patient feels lightheaded, you lay them back in the chair. There's a name for that. That's called the vasovagal response. And sometimes if someone's dehydrated or they're just more sensitive, the injection makes them feel, the blood flows to the legs. It makes us feel like we're perspiring or uncomfortable. How are you feeling, Stacy? You doing okay?
Yeah.
She's doing great. And it goes away instantly when you lay somebody back in the chair. Okay, so now I'm just going to do some massage. It feels nice and smooth. So I like what I feel and I like what I see. So let's take a look here. Stacy will definitely pass the grocery store test today.
Yay.
Make a big smile for me, big smile. So it looks natural, it looks good, and we're going to compare where you can see the creases that they're deeper here. They're definitely softer now. I'm going to have you look straight ahead so we can compare. Here's the before, this is the after. A little bit of redness. I don't see any bruising. Bruising may come, but it's unlikely. If you bruise, you can cover with makeup. So, are you happy with what you see?
I still see that.
Right. So here's, this is good, right? So you still see that area. This is what, number one syringe of Radiesse will do.
Oh,
Number
okay.
two, you don't want to taste the chocolate cake before it's done baking. You got to let that part settle.
Right.
Now for the deeper corners of the mouth, I have hyaluronic acid, which can do a little bit better job, but it doesn't last as long as the Radiesse. I can do Botox there, but this is one syringe. So we'll see Stacy back. I like to do it in about 6 to 8 weeks. And we're going to look at your pictures, and if she's happy, we leave things alone. If we need to add more, we can always do that, but this is the approach so that we don't go too far.
Okay.
Okay? So this is a good demonstration. This is how the body responds to one syringe of Radiesse. We can't make things perfect. We'll make them as good as we can, and we're going to keep you safe. We're going to make sure that you look natural. And this will also help to prevent the deepening, the future Holland changes, and then go for as much improvement as possible. So congratulations. We'll see you back. If you have any questions before your next appointment, you give us a call. We'll give you the hugs and hugs and hugs and hugs. Hugs and hugs for you. We're on a mission to stop bad plastic surgery. We'll do things the right way. We're here to raise your standards. I'll see you in the next video. You did really great. Looks good. Looks very natural. And that one